All right, we've talked about the behavioral adjustments. We've talked about how to make these changes at the point of performance. But let's also face it, by themselves, they're not enough. Only a third of ADHD children respond enough to those changes to not need medication. And even many of those would still benefit from their medication. But 2/3, and in my experience it's as many as 80%, are going to have to go on medication at some point in life. Maybe it's not this month, maybe it'll be in 6 months, maybe it's a year. Just depends on how compassionate and cooperative the caregivers happen to be. And of course how severe the ADHD happens to be as well. But at some point, these medications will be needed for most children. So I want parents to know them and to know about them. Now, if you're looking for a very good book, the single best book for parents on psychiatric drugs is by Doctor Timothy Willins. Straight Talk About Psychiatric Medication for Children. You can get it at the ADD Warehouse. You can get it through Guilford Publications at guilford.com. Willins, W-I-L-E-N-S. It is a parent's book on psychopharmacology. Straight Talk About Psychiatric Medication for Children. So quickly, let's go over what's out there. Right? First of all, parents need to know we have stimulants. There are only 2 now. We have had them since 1936 for the amphetamines and 1957 for methylphenidate. They've been around a long time, which means we know a lot about them. We know how safe and effective they are. These are the best studied drugs used in pediatrics and psychiatry. So parents need to understand that. We got a lot of information out there on the safety and effectiveness of these agents.